Today on the Lesley and Lisa show, we have a gynecologist.
So we're going to ask all of the questions you are too embarrassed to ask, and men can watch too.
So join us.
Welcome to the Lesley and Lisa show.
Hey, welcome to the Lesley and Lisa show. Hi, Lisa.
Hi, Les.
Hey, today we have a gynecologist on.
I know.
I'm so excited.
I am excited too. I don't know if I've ever had a conversation with a gynecologist that wasn't my gynecologist.
Exactly. And I'll be honest, I don't think I've ever seen a talk show with a gynecologist on it, except maybe like one of those doctor shows.
Yes, right. Yes.
But we're going to ask like some crazy questions that I actually have asked my own gynecologist, but
Okay.
I wanted to ask her just different perspective. It'll be fun.
I love it.
Can I just say, since we're talking gynecology, I have to say that my first gynecologist was, I think when I was going to college, they had like a clinic on campus, but I didn't go there. I went to see somebody outside. I was roughly 20, 21.
That was your first time?
Yeah, I know, crazy. Because I was still seeing my I wasn't having those exams at my pediatrician. I want to be clear about that. But
Right.
I just hadn't seen a gyno. Anyways.
Okay.
But my first gynecologist was Dr. Bonnie Beaver.
Literally?
Yeah, that's her name. And I believe that was her maiden name, but she chose to stick with it. Like she did not take her married name. How rad is that?
I think that's hilarious and phenomenal.
Right? She was the very first gynecologist I saw. And then I switched over very shortly after to the same man that I continue to see to this day. So I've seen him since I was 22, I believe.
Oh, wow.
He was my OB when I had both my babies, and I'm very close to him. I love him.
He must have been a very young doctor when you first started going to him.
He was young and hot, and he knew it. And
no thanks. I don't need a hot gynecologist.
I know. I had a male. Did you see a male, female?
So I had a male gynecologist from the time I was 17 until he retired when I was like, I don't know, 20 something. And then I started going to a woman, and when I got pregnant, and I knew I was pregnant, I had taken several tests. We went in and did the exam. She's like, yes, you're 7 weeks pregnant, blah, blah, blah. Meet me in my office. I'll answer all your questions. And I had a list of like 15 questions.
Yeah.
Nothing crazy, just like, when do I start doing this and whatever.
Basic
My third question, she did this. And I go, well, that's all my questions.
Oh, you didn't react? Oh,
no.
Gynecologist.
She rolled her eyes. I was like so hurt and pissed. And Russ and I walked out, and I said, I'm never walking back in there. So then I switched.
You could call her out on that and go, why did you roll your eyes?
You know, I should have, Lesley, but I think I was feeling so vulnerable already.
And you had all those emotions running too.
Exactly. And so I didn't even want to, it was so deflating. And to be coming from a woman, I was like, anyway, so then I ended up going to somebody, a friend recommended her OB and said, he's unbelievable. So I went to him, and I've been seeing him now for 11 years.
Amazing.
I don't care if it's a man or a woman.
No, I don't, but I will tell you that I think a lot of women have a very strong opinion about whether they see a female or a male. They really do.
And look, I get it. And I kind of, sometimes I think like, God, I want to explain something to him that I just don't know if he'll get. Like, I would love to be able to say to my doctor, when you feel that pulling, or whatever it is.
Yeah. He's like, yeah, not really.
Yeah, not really. He's like, yeah, but that's different for me.
I remember when I was pregnant, and I was right at the tail end of my pregnancy with Izzy. And I literally called my doctor, and I was like, I'm just so like, and the best way I could describe it, he was like, you're in pain. I'm like, here's how I can describe it to you. I have a headache in my vagina. And it's not like I can take 2 Advil and it's going to go away.
Right.
I have a headache in my vagina. That was the best way to describe it. And I figured it was the best way for him to understand. Like, it just was like throbbing and aching. And I was like, if I could get a massage on my vagina, I would, but I can't. So I won't.
You could have.
I could. That would have been a whole, but I was, about to have a baby.
Right.
Anyway. You know,
all of this and more is what you can expect for the next half hour.
But by the way, exactly. And when we say, oh, you know what, I didn't say at the top of the show that this is the show that we talk about anything and everything because nothing is off limits. This is when you're going to see that nothing is off limits.
Right.
Some of the questions I have, you literally might go, oh my God, why is she asking that?
Yeah.
Anyway.
Or I'll just go, I'm so happy I'm not asking this.
Okay, so let me just say our guest is Dr. Emily Sikking. She is a board-certified OBGYN serving all of Los Angeles, but in particular, she works in Santa Monica. She earned her medical degree from Georgetown University of Medicine and completed her residency in obstetrics and gynecology at the New England Medical Center. So she's a dumbass. By the way, do you know how many brilliant people we've had on as guests? And I'm like, I went to CSUN. I mean.
Which, by the way, don't say that like that's embarrassing.
Absolutely. It's not. I went to college, but still, like, these are some brilliant people. Just, you know.
Yeah, Lesley, I'm about 5 years away from grad, maybe even 6 or 7 if I keep doing one class at a time.
At 49.
At 49.
Listen, by the way, I'm proud of you. I'm proud
Thank
of you.
you.
I don't have a bachelor's degree. I never finished because I went on to my first series. So you're further ahead than me.
No, you're still further ahead.
Listen, well, because I'm older. But listen, there's something to be said for street smarts, and I got a shit ton of that.
I think that's something you and I can both say with great confidence.
So I'm sure Emily's in the waiting room. Is she there?
She is. Can I let her in?
Let her in. Emily.
Hi.
Can you guys hear me?
Yes.
We can.
Oh, great.
Can you hear us?
I can. I'm going to make it.
Fantastic. So we just had so much fun talk about gynecology and well, mostly about gynecology. I was telling Lisa that my first gynecologist's name was Dr. Bonnie Beaver. Do you know
lovely.
her?
No.
She works here in the Valley. And I believe she still works. Anyways, she was my first gynecologist, Dr. Bonnie.
Well, that's a totally appropriate name, right? I mean,
Completely.
I guess Sikking sort of works too, you know, but.
By the way, I believe that, and I don't want to diss her in any way. She was a wonderful doctor, but I believe that was her maiden name too. I believe she was married and never changed it. Well, I get it. You know,
Yeah.
Totally. Why would you?
Your last name is Beaver. Why change it?
Oh, agreed. Yeah.
Right. So
Absolutely.
that's going to lead me to my first question, Emily. So the obvious question of, did you A, always want to be a doctor, and B, when you decided to go to school and decided to go to medical school, at what point did you decide, oh, I get why you would be interested in obstetrics, who doesn't want to birth a child, but the gynecological point, what is it? I mean, how do you choose, like, you know, I'm going to look at vaginas.
Well, you know, so it's kind of interesting. When I was younger, my Jewish mother said that I could be anything I wanted to after I was a doctor or a lawyer. So that sort of was befitting to what I was going to do. And then when I was in high school, I had an aptitude for math and science, and I just dug them, and they just kind of came comfortably and naturally, and I liked the linear, you know, process of them, and you could learn facts, and then they had relevance, and then you could apply them and move forward with it. And so for me, that's sort of the way my brain worked. So for me, medicine just seemed like the kind of natural progression. And then when I was in college, actually, I went to Cornell, and they had these classes, and the courses that they had were actually at like the crack of dawn, and Ithaca is so
freezing.
Oh, right.
Freezing.
Oh my God, it's so cold. So when I was at Cornell, I was like, I can't do it. I can't do the pre-med classes. There's just no way. It's impossible. And so what I ended up finding were these weird classes that they had that were auto tutorial. So they were like lab based. So I could just go into the lab anytime I wanted to and do the work. So I would go to my classes because I was in biological anthropology and art history major. So I would go to those classes, and none of them started early. So all of them were a little bit later. And then in the afternoon, I would literally just jam into the lab, and I'd be there until like 10 or 11 o'clock at night, and then go on my way home. And Cornell's sort of notorious for like work hard, play hard. So then I would, on my way home, like hop into the bar for like last call. So it sort of worked for me. And it made sense. So it all kind of like fell together, sort of like a perfect fit.
But where does the obstetrics and gynecology come in?
Yeah, that's the kicker. So that was the last thing I thought I was going to look at all day long.
Exactly. Well,
not exactly. I was like,
here's the funny thing. I did say to Lisa, I wouldn't want to look at a vagina all day. However, I've never actually seen the inside of a vagina. And so I said to Lisa, you know, sometimes like the human body must be fascinating once you open it up. It's like a fascinating computer. So I said to Lisa, maybe the inside of a vagina is fascinating looking. I don't know. Yes? No, maybe?
I mean, really. It's not. It just kind of looks like the inside of your mouth is the same mucous membrane sort of appearance. So it's kind of like looking in your mouth, but like without teeth. Thank God.
Yeah, if you're lucky.
Know, some might.
Yeah. So basically, when I got to medical school, I dug everything that I was into, and I thought it was great. And I was like, oh, I like working with my hands. I want to be a surgeon. I'm going to be a surgeon. I'm going to be a surgeon. And everybody said, when you do your third-year rotations, you got to do obstetrics OBGYN before you do general surgery, so that you have you're capable in the operating room, so that all of the general surgery attendings that you work with think that you're like on it, you know, and that you kind of already know your way around an OR. You're not going to like contaminate anything, because that's always a bad no-no. And as a medical student, you never want to walk in with all thumbs. So what ended up happening was I did the OBGYN rotation, had almost no obstetrics experience, didn't even deliver a baby on my rotation really. And then, but in gynecology, for some reason, I ended up with a bunch of gynecologic surgeons who were the attendings, who were at one of the private hospitals that I went to. And they were so awesome, and it was so much fun. And I'm like, oh, you can do laparoscopy, which is like looking through little cameras and ports and minimally invasive, or you can do open surgery, or you can do vaginal surgery, or you could do hysteroscopic surgery with a little camera inside the uterus. And I'm like, oh my God, it's amazing. And women, you know, you cut them open and deliver a baby, and they've got this incision, and they're like cleaning the room, you know, feeding the baby, and they're like, everything's all set and ready, and they're like, when can I go home? You know, and then I got to general surgery, and I was like, ew, like, ew, right? Ew. I mean, it was like gross. It was all bowel, and it was like, you know, fungating masses, and just like, it was just so, for some reason, my exposure that I had for my general surgery rotation was so unappealing.
Which much more ew than the vagina.
Yeah, and it just didn't bother me that much. So, and
by the way,
on top of that, you go and you see a man after surgery.
Yeah,
they're like, oh.
Well, no offense,
like,
but you compare a woman with a cold to a man with a cold, and one is clearly on their deathbed, and then the woman is like, I got it.
Yeah. By the way, I totally get it. And then the bonus is that you get to deliver babies, because there's nothing better than that. Yeah.
So I kind of like, I always think of people as like surgical people or medical people. So you're either a surgeon where you're like, do stuff and you're very like, you know, reactive, or you're medicine and you're like, I need to think about that. I'll get back to you, you know? And I kind of walk the line between. I also like the idea that I have, because doing obstetrics and gynecology, you have maintenance of patients. You know, they come in every year, you have practice, you have something that you can like grow on, something that you can build, something that you can own, so to speak. I mean, I feel very responsible for my patients. And then you also have like surgery. You're in, you're out, you can like fix stuff. It's cool. You know, most people are pretty healthy. They're not like sick. And then you have the flip, where you have the obstetrics, which is now so fun and so fulfilling and rewarding, and you build this really amazing bond and relationship with people
with the family.
It's such an important bond too.
It is. And you get to take people through this like incredible process, and really build, I mean, honestly, I say this all the time, like 95 to 98% of my patients I'd have over for dinner if I haven't already. You know, like, I love my people.
That's
listen, when my gynecologist retires, which I don't imagine will be that long, and I've got my new gynecologist right in front of me.
Nice.
So I want to start with my first question. I mean, I have one question. So Lisa and I, I recently had my yearly pap smear, and every time I go in for my yearly pap smear, my doctor, once the speculum comes out and that part's over, he then does a rectal exam every time. Lisa was like, what?
I was like, well, I've never had a rectal exam from my gynecologist one time.
Yeah.
Common?
Well,
Not common? Does my gyno just like me? I don't know.
Well, I think it's a little bit of it sort of depends on a couple different things. It depends on your history. It depends on if you have a history of pain and they're trying to figure out whether you've got any sort of endometriosis or thickening of the rectovaginal septum, which is where the rectum and the vagina come together on the back side of the wall of the vagina.
Oh, that's not technically called the taint. I thought that was a technical term.
And by the way, the perineum,
yeah.
Perineum.
Yeah. Yes, that people call the taint. And I always say that whenever we do it. And whenever I sit there with my young girls, when I bring them in for their first time and I give them a mirror and they're like, oh, and I'm like,
wait a minute.
No.
You give your new patients a mirror so they can see?
Yeah.
Oh, that's so brilliant.
It taint the ass and it taint the vagina.
Oh yeah. No, I give them the whole like song and dance, like, this is your clitoris, this is the clitoral hood, this is where all the energy, this is where
I need her.
Urethra is, this is where your vagina is, this has hair, this doesn't, blah, blah, blah. I go through all that.
That's
awesome. Dr. Sikking, I'm sorry. I have to stop this entire interview. I'm going to drive to wherever you are and hug you because that is so important. I'm going to cry.
Oh, yeah.
I've never heard of that. And that is everything because
totally.
how many girls don't even know how
you know what? So by the way, so very important. You're right, especially for a young girl who's coming in. Like I saw my first gyno at what I think it was roughly 20. But you're right. Maybe that's another question I had asked Lisa. I think there's this really strong opinion about women who only want to see female gynecologists, or it's okay to see male. Maybe that's something, maybe it's just specific and special about you that you're willing to be like, let me give you a mirror and explain your entire anatomy, which is so important.
So many women die without ever seeing their own vaginas.
I know. I think it's weird. I'm like, you guys need to be friends. Like,
I don't know if I want to be friends with my vagina, but
yes, you do.
Listen, I have so many more questions, but I don't want to take it over from Lisa. Can I ask another, or you want to ask?
Let me ask.
I was supposed to answer your one question.
The butt question.
Right.
Yes.
So I don't do that to patients because I feel like I get an adequate exam. Not that other people don't get an adequate exam. It's also of the time that I was trained, that was not considered a routine thing that you needed to do because it's also checking for colon cancer, where you do like this test to check to see if there's blood in the stool. And so that actually kind of came out of fashion to do. And then now they have other things that they're doing. And I'm like, listen, you get to go see your gastroenterologist to have your your stool checked. That's not my responsibility. Although as a primary care doctor, which is what I do a lot of, I do send patients off with various different screening mechanisms in order to test for colon cancer, and I make sure they see their gastroenterologist and things like that. But in general, it's a little bit of like personal preference with a doctor.
I mean, by the way,
I don't do that.
Personal preference. I don't personally like someone sticking their finger up my ass, but okay.
An ass and vagina at the same time. Yeah, it's like,
it's a lot.
I mean, it's the same as anything. It's like, I know what it feels like. So I'm like, why would I want that to happen in a clinical setting?
Absolutely. All right. I have a question.
Yeah.
So we have all grown up calling our privates vagina, if we even are comfortable saying the word, because most people are like, my hoo-hoo, my wee-wee, my ha-ha, whatever.
Yeah. I hope they don't call it their wee-wee. That's weird.
I don't know. So I have a friend who insists, she gets angry if you call your vulva your vagina, and she has raised her kids to call the outer part of your private area your vulva, and she thinks words are very important and everything. And I said to her, she's one of my closest friends and I love her dearly, I'm like, sweetie, nobody else is calling it their vulva. They're all calling it their vagina. What do you think about that? Like when you're talking to these new girls that you have in your office, are you saying this is your vagina, or are you like, this is your vulva and then in here is your vagina?
Well, when I do sit down with a mirror and we go through everything, I do explain like, this the whole outside area is the vulva. This is the mons, which is the top where you have hair. These are the labia majora. These are the labia minora. You know, this is the introitus. You know, these are the terms so that they know this is the opening to the vagina. Like
What's an introitus?
Introitus is the opening to the vagina. So it's
Okay.
basically like that part, you know, where you have like everything on the outside, and then you have this like opening area. It's called the introitus. It's that area.
Okay.
You have like the hymen and the opening of the vagina on the bottom, and then up above you have the urethra. But they're all very close to each other. So in like explaining things, yes, I use terminology so people understand what I'm saying, but colloquialism, like if you're going to go like as far as, you know, you're not going to call it your like hoo-ha, you know, then if you're not going to call it your hoo-ha, then vagina is just, it's a prettier word than vulva.
I think so too.
Well, listen, vulva sounds like, you know, I live in like, I don't know, New Jersey, and I'm driving my vulva. You know,
Yeah.
like it's just, it doesn't.
I'm with you. I'm totally with you. Whereas there's nothing that's a vagina, man.
By the way, quickly, Lesley, my husband went to the U of O, and so this is, I'm probably doing it wrong, but this is their sign. So now I'm going to always do this
The University of
secretly.
Oregon isn't an absolute O. It's kind of like a.
Well, no, theirs is an O,
Maybe.
but I'm going to start
Or
doing
delta.
this to represent the opening to my vagina every time we're
there
at
you go.
football games.
Your
Yeah.
introitus. What was it called?
Introitus, yeah.
Introitus.
It's like the little opening.
I was gonna say you're intrepid, but that's
Well, you could go there if you want to, but that's like, you know,
Okay, so I have so many questions.
Hey, go. I'm here.
I mean, you talked about labia minora, majora. Okay, I don't know which one is going to be first. Okay, my first question is, so once I got divorced, I started using my vibrator probably a little too much, and I've just gotten to a point now where, look, there's no man that will ever be the power of 2 AA batteries. That's just, you know, whatever. That's just, it is what it is. However, am I killing my clitoris with my vagina? Like am I just
God, no. It's impossible. You can't.
It's impossible to deaden?
No, you can't deaden it. In fact, I have a rule. I have a mantra. Let's put it that way. I have a mantra: body, soul, spirit. So every 3 days, you're supposed to feed your body, your soul, and your spirit. So if every 3 days you're supposed to feed your body, your soul, or your spirit, how are you supposed to do that? Because I sort of believe on this 3-day cycle as opposed to the 7-day cycle. I don't know where I got it from. I at some point it just kind of clicked, and I'm like, yeah, like we live on 3-day cycles, not on 7-day cycles. For some reason, it just made more sense to me. So when I started kind of pondering it, and I don't know, I came up with a sort of epiphany of like, how do you take care of yourself every 3 days? And body, soul, spirit seem to work. So it's exercise, meditation, and your vagina, right? So I believe that it is healthy for you to exercise at least every 3 days, to meditate every 3 days, and to do something with your vagina every 3 days. If there's a heartbeat in the house and you want to use that heartbeat, fantastic. If not, you can use batteries, or no batteries required. It's not necessary, you know? So whatever works for you, but there is something about taking care of your whole person as a woman that I think is really key. Generally speaking, now I don't take care of men that much, and I have men around me in my life, but I don't sit down and be like, so how often do you masturbate? But I do think that there is a connection that you have to yourself, and that's why when young girls come in, I kind of give them that little bit of like, you know, you have to take care of yourself. I mean, everybody tells you you're supposed to exercise, you know, a certain amount, and it changes all the time. But I just sort of like every 3 days, we're talking twice a week, man. You can do it twice a week. You know, you can exercise twice a week, you can meditate twice a week, and you can do something with your vagina twice a week. It's certainly not going to kill you, and it's probably going to make life a hell of a lot more worth living for. So if you're using your vibrator or whatever, I mean, there are so many out there.
Oh my God. There's
like,
so many different, and I've been,
it's like unbelievable. I mean,
yeah.
it's just unbelievable. you have to be careful Googling too much stuff, because then suddenly you get, they track you, and then suddenly.
Oh, absolutely.
Oh yeah. Listen, I think I was 20. I think I was around 21 when I bought my first vibrator. I bought that rabbit.
I
that was
remember.
Yeah, everybody's got a rabbit. Yeah.
And then I used it and was like, oh my God. And then I went back to the store and bought 5 more to give to 5 different girlfriends.
I received one of those.
She did receive one of those. And I was like, here is my gift to you. You're going to love me forever for this.
Yeah, that's awesome.
So you would say that orgasms are very important to your health and your mental well-being.
Absolutely. I mean, it's part of the connection also that you have with your own body and your femininity and being a female and a woman. I mean, I think those are all really, really, really important things. Do I think that it's a requirement? I mean, I think it's personal, but I strongly encourage it. And it's sort of like my little mantra that I send all of my patients home with every year. And they come in sometimes and they're like, I'm working on the every 3 days. I know, like they already come in knowing. I'm like, okay, now I have I know.
I love it.
So cute.
Okay, so I can't kill it.
Nope.
Can I desensitize it at all?
Nope.
Or literally,
Nope.
so I feel so much better now. I feel good.
I'm so glad.
I feel better about that.
Okay,
Okay,
I actually have a question that to continue off of what Leslie's saying, that I'm going to say I'm very embarrassed to ask it, but I'm going to.
There's
I'm
nothing
gonna do it.
embarrassing to ask about anything. I never think there's an embarrassing moment.
Here's why: because I'm not in your office, and tens of people are going to see this. So sometimes after an orgasm, I do find that I'm a little numb down there.
Oh yeah.
Well, that's just because you're still having like kind of a recourse of all of the nerves being stimulated.
Okay.
So it just takes a little while. It's just you have so much blood flow that goes to that area as you're having an orgasm, because it's a huge amount of blood flow that goes there.
Okay.
That your body can just be like,
So that's not weird.
No.
Okay.
No. And there's nothing wrong with you, and it's not going to stay numb forever, I promise.
Okay.
It's so funny listening to her talk. Like I think to myself, if I was a man, I don't in a relationship with you, I might be a little intimidated to have sex with you, because I'd be like, what if I do it wrong? She knows everything the right way.
Right.
I mean, I think it's really, it's like when you said like no man is ever going to hold up to my vibrator. Like I'm so much better with that than I am with anything else. I mean, the reality is that it's like exercising, it's like anything else. Like if you figure out what works for you, then you're just that much better at doing things, and it's different. I mean, I don't think that masturbating and having an orgasm are necessarily the same thing as having an intimacy with a partner.
Yeah,
absolutely.
So
Plus,
I
men like it.
So you're not going to hurt yourself, number one, and number two, there's still a place for relationships, because I think those are still very relevant.
100%. By the way, I'd like one. And then I think it's very healthy in a relationship to use toys. I think toys are fun in a relationship.
Sure. Absolutely.
I think it's fantastic. Okay, so my next question is, again, once I got divorced. So, listen, you have children, you get to a certain age and you're like, the whole thing down there just feels tattered and torn, and I'd like a little facelift. So does anybody ever come in and be like, I'll be really kind of crass and say, I want a pussy lift? People want and by the way, I think there's 2 parts to that. I think there's the inside. I know that there are things like the Mona Lisa and other things that you can do to tighten up the insides, but what about prettying up the outsides? No? Yes?
So,
Did you ever do that?
To me, there's really no ugly vagina, because that's not really about. It's not really anything that you need to be insecure about. But people are, because of all of this. Like
I have girlfriends who
the internet.
I have girlfriends who also spoke to me specifically, and they're like, oh, ask about the skin that hangs down a little further and almost appears to be like a little tongue sticking out or something. I imagine that is your labia minora. That's your minora, and it's gotten stretched out a little. I don't know.
Or some people just have that longer than their labia.
Right.
That's like a longer toe.
Right.
Well, no, it's just the way you're made. I mean, and anatomically, everybody's a little bit different. Just like, I mean, there are people who want to get their You know, I think the cosmetic component of your vagina is so personal.
Yeah.
The functional component is totally different. So I'm going to go like two different things. So I'm going to
Okay.
answer your question because to me it's two separate things. Okay, so there's a functional component. Okay, so the functional component is it's got to work, right? So it's just not okay when it doesn't work. It's not okay with me. So there are things you can do. You said the Mona Lisa. Yes, it's a CO2 laser. It resurfaces the superficial tissue and the mucosa of the vagina and the outside. It helps with constituting normal tissue and normal lubrication, normal elasticity. So there's a lot of great things that go along with that. Mona Lisa was sort of like the first one that came out, so that's sort of what everybody talks about. There's also radio frequency, and there's these other ones, all these various different kinds. And I think that they have an appropriateness for specific patients depending upon what their needs are. So there are a lot of different things you can do that are in the office, that are safe, that have been tested, and that are very effective for non-surgical and non-medical, right? So like hormones and things like that people are kind of a little leery of, or maybe they aren't and they want to do that too. So there are various different things. So it sort of depends on the function. So there's a functional component. In addition to that functional component, there are some women whose labia, from the time they go through puberty, are just a little bit longer. They're a little bit more lax. One side's a little bigger than the other. I mean, we are asymmetric.
Right.
Yep.
Down the middle and did a line, you look like
Yep.
So same thing with breast tissue, same thing with the vagina. So when some people have like a thing about that, like it's like their scarlet letter, which to me just doesn't make any sense, because you should be super comfortable with your vagina and you should feel very confident with it. So I don't think there's ever a reason why someone should not feel that way.
I've also never heard of a man saying that vagina doesn't look good enough for me, or a woman for that matter.
Can I tell you something? No, because I live, especially now, we're living in a day and age of pornography, and we all watch pornography, and some of these women, like, I don't know, these vaginas just look.
Sure, but to speak to that, Lesley, listen, so I'm sure you both have seen many Playboys from the 70s and 80s where women still looked, you know, how you're born. If your boobs were bigger, they hung lower, all that stuff. Most men I know prefer a woman that looks real.
Right.
I think. I'm nothing against people who have implants or anything like that at all. I'm just saying that, you know, you could look all day at things and think, look, porn I think of porn as, oh my God, I'm never going to be that hot when I'm having sex. But like, you know what? I am who I am. So all of this to say, to compare yourself to those people, whether it's your stomach or your boobs or your vagina or anything, is not healthy.
Right.
Oh, totally. But it is a reality.
Sure.
Yeah.
So as much as like, I would love to be able to live in a world that all the men function like what your exposure is and around you, which I would love. I mean,
yes,
it's a very adult, a very adult developed human being,
right?
Who looks at things from that. But there is a social component, a social media component to this.
Sure,
it is kind of unbelievable, and it has translated to the vagina too.
Right.
So there is a functional component to it, where there are girls and women who have issues with their vagina because either they wear a G-string and they can't really fit the labia minora in the G-string, or they feel like they have like a bulge, or one side's different than the other, and when they have sex, when they horseback ride, when they do gymnastics, when they run, whatever it is, they just feel like one side either gets caught or tears or gets swollen or uncomfortable. And that's a functional side of what we call labiaplasty or labial reduction, where you can actually trim the vagina, the labia, in order to either make them match or to just make them a little bit smaller. I'm kind of in the mindset
you do that kind of, is that the kind of surgery that you would do?
Yeah. I mean, plastic surgeons do it. I'm always fascinated by that, but because they don't look at as many vaginas as I do.
Right.
Yeah, I'm not sure how they counsel patients for that. I find it sort of funny. But I mean, everybody has their niche. So if that's their niche, fine. I mean, I got no issue with that. As long as you're making people look, as long as you're making people feel better
Yes.
about how they look, then you're accomplishing what you're trying to accomplish. And what I always do is I do a lot of counseling with patients who want to have that done, because they either have like a scarlet letter about it, or they're really, self-conscious about their vagina and their vulva. And it is, now we're going back, vagina, vulva. Okay, so this is really labia minora for most people. That's what most women have an issue with, is their labia minora. When they talk about, like, they're larger, or they're loose, or they're, whatever, asymmetric. And honestly, like, it's not a, oh, you want to look like when you were 12, which I think is weird.
It is weird.
It is weird.
Which is why I think the entire bald vagina is a little weird, but okay.
Yeah. So that, to me, it's more like you guys need to be friends early on, so you guys can get comfortable with each other, so that you guys have a relationship, and that you have a connection, so that you embrace the fact that this is your vagina.
Sure.
Just like you have your eye color and your lips and and can you fill them? Can you do stuff to them? Of course, there are a lot of people who do that, but in general, you're looking at trying to encourage people to be the best that they are, as opposed to trying to be something else.
Right.
Sure.
And the vagina is an important place.
Absolutely.
But you're right. There is that component because of, like you say, social media or what have you.
Oh, yeah.
All of a sudden being thrust into being single again, and 48 or however old I was, I felt a little pressure. And I had, I'm close to my gynecologist. So we did have these very frank conversations. And I literally, like, I had said to him, what about this? And his first reaction to me was, are you getting into an adult video? Like, is that what do you have a new venture in life? And I was like, no. And he was like, then why the fuck are we even talking about this? Why are we talking about bleaching and lifting and this? Like, but just be happy with your vagina.
But it's like, if you're not, if you're not happy with it, you personally are not happy with it, I could see wanting to fix it completely. But if you're doing it because you're afraid of how the outside world is going to see it, that's a different story.
Yeah. And that is part of what it is.
That's what it was for me. It was all about, all of a sudden I'm going to be dating again. And I felt like I had to have my 25-year-old vagina, not my 48-year-old vagina.
Right. And then, so again, on that, like, functional thing, like, once you have vaginal deliveries, if that's what you have, there is a change in the vagina. It changes its kind of dynamic, but it also changes sort of its anatomy, because it has been stretched out. Maybe you have a tear. Maybe you had, a bad tear that didn't repair, someone repaired it and it didn't get repaired as well, or you have some laxity, or you don't have tone like you used to. It's like, as you get older, I remember when my dad turned 50, and a family friend of ours said, you never trust a fart over 50. So it's one of those, like, funny lines, that I grew up with. And it's really for women. It's like, you also don't trust a cough, a sneeze, a laugh, because you might leak, and that's really a functional, but it also can become very, like, you can become very self-conscious about that. And you become like, like this is my vagina. It doesn't work as well as it used to. And so the bladder and the vagina do go hand in hand. Like, a lot of urologists and gynecologists do work together in order to improve the function of the vagina. But at the same time, the function of the vagina is being able to, if you so choose, to be sexually active and with vaginal penetration potentially, or at least clitoral stimulation, or some kind of contact that needs to be a positive thing. When women get over a certain age, the vagina just doesn't have as much estrogen in it, and it just gets drier, it gets thinner. It hurts, for people to have sex.
I'm 52 and knock wood. If you ever told me that I would be grateful every time I get my period, I would tell you were crazy, because when we're young, we're like, oh, I have my period again.
Right.
But now at 52, like, I track my period, it comes and I go, oh, thank you, Lord, I still have my period. Like, I'm so excited that I'm still, there's a part of me that feels like I'm still kind of hanging on to my youth in some strange way if I still have my period, because I've heard some bad stories about what comes post menstrual. So,
Right.
And
there's a lot, thank God, we've come a long way on that. There's a lot of good stuff out there. There are a lot of good options now with like the different vaginal treatments and lasers and things like that. There's a lot of good stuff out there.
So lasers can really help with that. Like even if you're not taking hormones or whatever. Yeah. Wow.
Yeah, it can really improve.
How important? Oh, go ahead.
Nothing's a panacea, so nothing's 100% for everybody. But
does insurance cover any of that stuff for people, or is it all elective?
It's mostly not covered, unfortunately, and that's really
it's a shame.
It's a shame, and it's an unfortunate sign that we haven't evolved quite enough to have that be part of insurance. Because I'm pretty sure if someone's penis doesn't work, insurance covers it.
Yep.
You bet, because they cover Viagra.
Yep.
You bet.
Yeah, they 100%. Also cover like implants, and they cover, all sorts of stuff. Yep. So it's a little disconcerting. But we're going to get there. I just have to do everything I can do in my little world to try to make sure that everybody's vaginas are functioning properly. And that they're educated and they can make them function, and I do whatever I can to help that.
All right, so I have a question for you because I feel like you're the perfect person to ask this.
Right on.
Kegels. I want to know how important they are. And what?
You probably should do it like 10 times a day.
Well, I want to know not only how often you should do it, but can you very specifically explain how to do them properly? Because I keep hearing if you're not doing them right, you might as well not be doing them. So I want to know how to do them properly and how often.
Can I just say this? Well, you say the word Kegel or Kegel, I don't know which one it is, and it immediately makes me want to do it. So I'm doing it right now.
Oh, totally.
Okay, which is what you're supposed to do. I always tell people, like, do it when you're at the stop sign or when you're at a red light. Because it's sort of the point is to do it all the time. It's like exercising any muscle in your body. If you don't exercise it, it doesn't work as well.
Mm-hmm.
So Kegels are basically Kegels, whatever. It's basically tightening up the pelvic floor and trying to improve that function. Now, when you've had children, that pelvic floor has been traumatized. And if you have had nerve damage or any sort of excessive muscle tearing or fascial tearing, then it doesn't work as well. So it doesn't make a difference how many Kegels you do. You are not going to be able to control your urine flow or keep it up.
Mm-hmm.
Same thing with never trust a fart after 50. So
right.
All those kinds of things, and also it can change the tone of the vagina for you to be able to control it. So that aside, a normal vagina or pelvic floor of someone who has not had children yet, so to speak. So what you do is the easiest way that we generally tell you how to do it is when you're peeing, stop the flow.
Right. That's it.
That's the muscle. Okay. So it's not your glutes. It's not it's not your belly. It's a totally different muscle than what you normally do, except when you're like, oh my God, I gotta go. And you just, you do it.
Here's what I think in my head, because I always was like, imagine if you're peeing and somebody opens the door and you go,
yeah, good one. I like that. I might have to use that. Can I use that?
But then how long should he, she copyrighted it. Just now. Okay, so how long do you have to hold it for? Because I do them all day as well, by the way.
Okay, so there are a lot of different recommendations out there. I like doing things that are simple. So you have to figure out what you can do. It's sort of like my rule of every 3 days. Like if I tell you have to exercise every day, you're going to get on the bandwagon, you're going to do it, and then you're going to fall off the bandwagon because it's not something that you can actually do. I think every 3 days is feasible, right? So if you can, with Kegels, it's the same kind of thing. It's like, you want to find a way that makes it functional for you, that you can incorporate that into your life. So if you can sort of get in a program where you are doing something that you are doing more than what you would normally do, then that's better than nothing. Okay. So that's kind of my philosophy.
I've Kegled 20 times
so
since we
if
started this conversation.
I love it. So if I had my druthers, I would say if you can do somewhere between 3 and 4 times a day, right, would be ideal. And you can do anywhere up to 10 Kegels. And the idea of doing the Kegel is that you actually tighten and hold and down. It's sort of like that. I mean, I don't know if you guys had this, if you guys have kids or whatever, but with my kids, when they would like get upset or something would happen, they had this like breathing square thing where they were like, you breathe in for the count of 5.
Yes.
You hold it for a count of 5. You breathe out for a count of 5. You wait a count of 5, and you do 5 repetitions of that. You know what I mean? So it's like whatever square you can come up with. If it's like you can hold it for 4, keep it for 4, release it for 4, wait
Okay.
for 4, do it again. You know, it's not like rapid fire.
Right.
If you're someone who has a weak pelvic floor, like other things, can you start now and regenerate some of that strength, or have you lost, are you already at a loss there and there's
Well,
no?
I mean, I think it depends on, like I said, the trauma. If you've had trauma and it's just not gonna, you know, it's not gonna do anything because the nerves are traumatized and you just didn't get on. Like I try to encourage my patients who are postpartum to do physical therapy afterwards for many different reasons. One is for pelvic floor, you know, encouragement to get you back on track, and then also just to get your body back and to feel like you're never going to get it back. I sort of think it's just going to be different, but now you have a baby. Awesome.
Yes.
You know, but there is that kind of functional component to it. So the sooner you can start things, the better. Obviously, I'm not going to say otherwise, but there's no better time than the present. Like you can always do something, you know, there's nothing that should hold you back from doing something that should make you feel better and that should be better for you. And so to me, doing the Kegels is key to a like healthy pelvic floor. But you know, if you do Pilates, if you do yoga, I mean, you're using that pelvic floor a lot. My OB patients, the ones who are like, whenever they come in for delivery, I'm like, oh, I'm never going to get this baby out of your vagina because your pelvic floor is like iron, you know, it's like, they're like, you know, every time they push, I'm like,
That's
let it out.
Funny.
That's crazy.
They're just like, you know, they're just like, I mean, it's like, you know, militia, you know, I mean, they're so tight. It's like having like a 6-pack in your perineum. I mean, in your floor.
The kid comes out like this.
Yeah, I know.
Like I was being held in there like a.
Yeah, that's where you get the big cone.
Right.
Well, I just want our viewers to know that every time we're doing this show, I'm going to be Kegling. I'm just saying.
All right.
I've been doing it. By the way, you can't lie. You've been doing it the entire time we've been talking about it because it's like.
I have been.
Yeah. So
but I do them a lot anyway, but I have been since I said the word Kegel.
Yeah, I know. You're so good. You do that. So, but can we say
it's like
that
Pavlov's dogs, right?
Yes.
100%. So a lot of these sort of laser procedures can help with that like if you weren't doing your videos as much as you should. Because I am someone who tends to, and I say it all the time on the show, when I laugh really hard, I go, ooh, I think I just biddled.
Yeah, and that's not uncommon, you know. And some people just leak all the time. And some people, it's just like when I get on a trampoline and like, you getting up a trampoline? I'm like, oh my God, like I am
on a trampoline at a
right. You must have had a C-section because that's like, whoa, or no babies. Because not very many people can get on a trampoline. I mean, some can, obviously there's the outliers, but generally not so much. And it's a great form of exercising.
Exactly. Just wear a pad.
No, I'm not shooing like poo-pooing, you know, trampoline jumps.
No, you just have to wear some Depends diapers.
Right.
Anyway.
Yeah, it's just like, you know, and there are so many different things out there that people have come up with, and there are surgery, obviously, that's obviously the sort of the option. But for this, yes. So there are things you can do that improve, not necessarily the musculature, but you can improve the quality of the vaginal tissue, and in turn, it improves the epithelium of that vaginal tissue. And it ends up having a positive effect on bladder function. So what it does is it stimulates that bladder function to be more normal. So it can improve the urethra, which is the little teeny opening that goes, so it's kind of like this, right? Like we're going back to that thing where you have like your dome of the bladder, and then it goes down into this short little canal, which is where your urethra is. And that's why women get getting UTIs and stuff, because men's bladder goes to this and then it goes to this long shaft. Whereas women, it's really short. And it's also like right on top of the vagina. And they're like right next to each other. And you're going from the urethra, which is the urine, which is sterile, to the vagina, which is clean. And then like right below, underneath the taint, the perineum, you have the rectum, which is not so clean.
Right.
You know? And so that's why I'm always like, right, front to back, front to back, front to back, front to back. You know, like that's like my big thing. And when I show girls, they're like, I had no idea it was so close to each other. I'm like, right. So that's why front to back. Remember that whole concept? You always wear front to back because you don't want to get UTIs. So point is that the urethra and the urine, where the urine comes out, and the bladder, it's sitting like right on top of the vagina. So when you treat the vagina, you end up improving the bladder and the urethra. So a lot of urologists tend to use, when women have bladder issues, even older women, they use vaginal estrogen. And the vaginal estrogen actually improves the bladder function and the bladder ability. So that's,
wow.
Yeah, and that's been around for a very long time. They've been doing that. There are a lot of other options that you have as well, not just vaginal estrogen now. Now we have like vaginal moisturizers, and we have, which is like a hyaluronic acid. And there's also like DHEA, which you can use. And there's a whole bunch of other things you can do for the vagina that are things you do daily.
That are safe.
Yeah, almost all of these things are really safe.
You know, it's interesting. We put so much, you know, so women are so concerned with their faces, what they use to wash their face, with how they, you know, the
yeah,
whatever the what's it called when you put on the liquid,
or whatever. Yeah,
all of that kind of stuff. We should probably pay just as much attention down there.
I mean, to me it is, because last time I checked, that's a little bit more of a functional thing, you know.
Yes.
So, you know, it's like, you know, it's like brushing your teeth.
Well, it's funny because we do pay a lot of attention to waxing and grooming and that kind of stuff, but it's like the stuff inside that's also needing attention.
Yeah.
I do think, and I think a function of that is embarrassment. I really do. I think so many women are so afraid to tackle whatever that is and say, it's just a part of my body.
Yeah, well, and they're, like you said, people are very self-conscious about that area, and and people, listen, neither Lisa nor I are pent up about this. I'll ask any question about anything, but a lot of people don't like to talk about the vagina. For God's sakes, they don't even like to say the word vagina, let alone talk about it.
Right.
Oh, yeah.
So I have two crazy things. So, you know, every time I go in for my yearly pap smear, I always feel the need to really groom and clean all up down there and look as if I'm all spiffy and fancy all the time, which I'm not. What's some crazy shit you see come in?
And actually, by the way, I groomed right before this just because we were going to see you, doctor. So in case you want to see, just in case you wanted to look, I don't know why you'd want to. Just in case.
So what I say to all of my patients, literally everyone, when someone comes in and anybody says anything like, oh, I'm so sorry, I didn't get to wax, or I didn't get to do this or whatever, I'm like, okay, so here's the deal. If you're doing anything for me, for your vagina, we have a problem. It's not about me. You should be taking care of your vagina and taking care of yourself for you. So it's not about me, and I'm not here to pass judgment or comment on the way your vagina looks or how you groom it. So I don't care. It doesn't mean anything to me. I mean, I remember, you know, my kids would say like really funny things. They're like, oh yeah, you see patients, but you have to tell them to like drop your pants, otherwise you don't recognize who they are, you know? And it's just like so ridiculous, you know? It's such like a goofy little kid, like, you know,
I love your kids.
But they're pretty funny. Yeah, and they've been using the word vagina for a very long time. And in fact, my son or my daughter, I can't remember which one of them, got in trouble at some point where someone was like, you know, your daughter or your son don't keep saying vagina. I'm like,
and what's the problem with that?
Right, really? That's a bad thing?
That is the word.
Okay, so my next question is, what is the craziest thing that you have ever had to, I don't know, maybe like pull out of a vagina that somebody might have, I mean, I can think off the top of my head. I'm sure there are a lot of
I haven't had any, I mean, I may have had them, but they just haven't been logged into memory. I have not had anything crazy. I have heard crazy stories, but I personally have not had anything completely insane. that I have found. But there are some crazy stories out there, I will tell you.
Can you give an example of what you've heard of what people have found?
I remember hearing a story, and this may be folklore, but it may not be. And the story was about a doctor who went into the clinic, and the patient happened to be Spanish speaking, and she was postmenopausal, and the complaint on the paper was arbor para vagina, which is basically tree in the vagina. And he was like, oh, yeah, I must be reading that wrong, you know? And he went in and he was like, so, and she says, arbor para vagina. And she said, I don't understand. And he lifted up the thing, and lo and behold, there was a little like branch coming out of her vagina. And he's like, okay. And you guys looks are so funny.
I can't
Apparently-
imagine.
If the movies are
Apparently
tree
there
grows
was
in Brooklyn,
some-
it's a tree grows in my vagina.
Oh my God, that's very funny. So apparently she had prolapse, which is where your vagina comes, like falls
Right.
down.
Mm-hmm.
And somewhere or another, it seemed like a good idea to put a potato up her vagina. And because of the moisture.
No.
Because of the moisture, it sprouted. Oh my God.
Oh,
So
That beats pulling an extra tampon, the one that
Yeah.
accidentally got up there.
this
that
is not my story. I am not taking credit for
No,
it, but
I
it's
know.
a great story. And I'm sure I elaborated on it in some sort of tweaked way, but it's such a great story. That it's
that's
one of those
phenomenal.
few. It's a phenomenal story. It's just, there's so many things in that. Just like Sue
Leslie,
said.
listen, I hate to do this, but we are approaching an hour.
Okay. Oh yeah. I'm sorry.
Please,
But
who cares?
Here's
No,
what
I
I want to
get it.
say. I would like you to come back if you would, so we could do a
Anytime.
part 2 sometime soon, because I think we're going to have many more questions and we're going to garner some from our audience as well. Would you come back?
Of course. Anytime you guys want.
Emily, serious, this was so much fun. Though I love my gynecologist, you will be seeing me in your office probably soon.
And me as
Fantastic.
well.
All right. I love it.
But when
All
I
right.
come in, will you do the thing with me with the mirror, even though
Absolutely.
I'd really appreciate that.
Absolutely.
I don't want that. Well, I do. Actually, let me ask one more quick question, Lisa. Don't get mad at me.
No, I'm not mad.
Assuming, young girls get their period, say around 12-ish or something like that.
Uh-huh.
Do you, listen, we usually, young ladies don't go to see a gynecologist. You stick to your pediatrician for a long
Right.
time. You don't usually see a gynecologist till you're somewhere around 17 or 18 or having sex otherwise. What's there to say about a young girl coming in for a checkup at the age right when they start their period and sort of getting some kind of baseline?
Oh, nothing. I mean, I have women, I have my patients who bring their girls in all the time at any age. I mean, they bring them in younger, they bring them in, you know, they've seen their pediatrician, they have a great relationship, they wait, or they have a family practice doctor and the family practice doctor takes them all the way through. But anyone who wants to come in. Like,
And
I'm cool with that.
you think that's great that you want to.
Oh yeah,
Okay.
absolutely. I mean, as soon as you can get someone comfortable with their vagina and with their body, whatever it is, the faster you can move them into a healthy place for their whole life. I mean,
I
it's
think that could change things for so many people.
I do. And you sort
Oh,
of,
yeah.
as a young lady, can get a sort of baseline for where you're at, you know?
yeah. I mean, my hope is that the pediatrician is doing
right.
that. But that may not be happening. I know that my kids, I love their pediatricians that they've had throughout the years, and they've all been wonderful. I know there was a point at which my son happened to say, I would rather have a female pediatrician, and I was like, why? He's like, because I'm kind of a little bit more comfortable with a woman touching me than a man. And that was sort of
interesting.
his perspective on it, which I thought was really interesting.
It is.
Because girls would say the opposite. Girls would probably, that's very interesting.
Yeah,
Wait,
no,
why
I mean,
did you just get embarrassed? What just happened? I
he's
missed
just
that.
going to kill me. He tells me.
Oh no! Don't let him watch.
No, I know. Listen, I was thinking before when I was asking a question about young girls, I was going to say something and then I was like, no, be quiet. You can't bring up your own children into this. I know.
Oh, okay. Yeah. Well,
Okay.
I just did.
Your son's not going to watch this anyways.
Yeah.
He's going to be, did what? The Who and What show?
Exactly.
Oh gosh. Well, I hope he hears about it. Just because I hope you guys are just getting the word out there for everyone about all these things, because I love the fact that you guys are having candid conversations with people.
I love it.
Yay.
Well, us too. Emily, or Dr. Emily, thank you so much.
Emily, that's my name. I mean, I call my patients by their first name. Don't you call it? I mean, I tell patients, I'm like, call me whatever makes you comfortable. I don't care.
Well,
I like Dr. Emily.
Yeah. I get Dr. Emily. I get Dr. M. I get Dr. Sick. I get
Dr. Sick.
Dr. Sick. I love that. Listen, this has been so much fun having you on, and I agree with Lisa. We could have you back for easily another hour.
I think we have another hour's worth of questions already, but we'll have even more.
That was just the tip of the I want to say the introitus. Is it called?
Introitus.
Yeah, that was just the tip of the introitus.
That's right. We're just beginning.
I'm so excited. I'm literally already so excited to have you back.
Oh, I'm so excited too.
Thank you for being here.
Right.
Emily, thank you so much for being here.
Absolutely. You guys take care.
Thank you so much.
Bye.
How do you leave? I know. That was so awesome.
I'm so sorry to cut it off. I know.
No, you're right. You're right.
Okay. Because we have so many more questions that I just think it's a whole other show. And she's
fantastic.
Not only is she, hold on.
She's funny. And seriously, she's funny and she's going to take me a little while to get this.
It's okay.
There it is. She's funny and she's brilliant.
Yeah.
And she's so well, she's just.
But here's the thing, Lesley.
I'm my gynecologist now.
I have to tell you, and I'll make this very, very brief, but I used to tour colleges, even though I didn't graduate college yet. I used to tour colleges talking about safe sex. And one of the things I would say to these college kids is get comfortable with your vagina, put a mirror down on the floor and stand over it. Yeah. But look, I think maybe I've done that one time, and I don't think most people do that. And I think we really are so embarrassed to see what's down there. And the fact that
I have done it, but I'm always like, and I judge. That's my problem.
Right. So. Which is, it cracks me up that you judge your vagina. I think it's.
Listen, I judge my hair. I judge my skin. I judge my vagina. Look,
okay. But the thing is, the fact that she's doing that, her patients are so fortunate. And I think every gynecologist should do that.
I agree. It's amazing. It really is. She's amazing. I'm going to be one of her new patients.
I just thought of another question I wanted to ask.
Oh, damn. All right. Well, we have to get her back.
We have so many. Okay. Listen, you like frank conversations about stuff? I mean, that's going to happen on this show, as well as celebrities and people we find interesting. And we find it interesting when you show up and you like and you subscribe. We want you to be a part of our community, so please keep coming back and comment too. Let us know what you think.
Let us know if you take a mirror to your vagina anytime soon and what it looks like.
What it looks like.
Okay, Lisa, this was so much fun. I love it. Go make dinner.
I do too. I'm going to go make dinner, and I'll talk to you soon, and I love you.
I love you.
Bye.
Thanks.